question period. I recognize the Leader of the Opposition.
Mr. Speaker, last Thursday, the Sask Party voted unanimously to defeat our motion to suspend the fuel tax and give Saskatchewan families a break. Mr. Speaker, does the Premier care to tell us why?
Recognize the Premier.
Very much, Mr. Speaker. The entire gas tax, plus that fund is added to, Mr. Speaker, make up the highways budget in the province of Saskatchewan. That's the highways. That's the highways investment that we make to ensure that our commodities are able to find their way to port position, Mr. Speaker. It's also the investment that we make in safer highways, safer intersections, Mr. Speaker, because it's our families that are traveling down those very same roads, Mr. Speaker, and we think that that investment is most certainly warranted. I understand why the members opposite don't correlate the gasoline tax with the investment in highways, because quite frankly, under their administration, they did not invest the entire amount into highways, Mr. Speaker. What they did is they took those dollars and invested them in other areas of government. It is a fact, Mr. Speaker, and you can check the previous budgets and public accounts on that, Mr. Speaker. Mr. Speaker, in addition to that, when it comes to affordability, I talk day in, day out about the $2 billion in each and every budget that is afforded to the people of this province, families of this province, due to the strength of our growing and vibrant economy. The tax affordability checks that went out last year, Mr. Speaker, to each and every resident over the age of 18, Mr. Speaker, and the savings in carbon tax on our home heating, natural gas and electricity, which is a larger number, Mr. Speaker, a larger number than what the Leader of the Opposition is advocating for.
Recognize the Leader of the Opposition.
Mr. Speaker, the Sask Party have shown through their actions how completely out of touch they are with the reality that Saskatchewan families are facing. 57% of people in this province struggling just to pay for groceries. And instead of using their power to offer them some relief, the Sask Party used their majority to say no to suspending the gas tax. Mr. Speaker, that tells you everything that you need to know about how out of touch this Sask Party government has become, and why, Mr. Speaker, it's time for a change. Premiers in Alberta and in Manitoba have provided this relief to people in their province. Why does the Premier think that Saskatchewan families don't deserve the same?
Recognize the Premier.
Asked and answered, Mr. Speaker, and what I would say and ask of the Leader of the Opposition and all members opposite is, in the very same vein, why did they vote against the budget? $2 billion in affordability measures in this year's budget voted against by the NDP, Mr. Speaker. In this budget was the enabling legislation to ensure that Saskatchewan families are not going to pay carbon tax on their home heating natural gas and their home heating electricity, unlike anywhere else in the nation. Why did you vote against that savings for Saskatchewan families, Mr. Speaker? We're going to continue to ensure that we have a budget that's put forward that allows Saskatchewan cities, Regina in the budget documents themselves, being identified as the most affordable city to live in the nation of Canada, Mr. Speaker. We're going to ensure that that is the case with the $2 billion that are again in this year's budget. We're going to ensure that we have a strong and growing and vibrant economy so that we can continue to make the investments in our classrooms, in our healthcare system, and in our communities.
Recognize the Leader of the Opposition.
Mr. Speaker, this government is failing to deliver on the cost of living, and they're failing to deliver when it comes to providing care to the most vulnerable. Today, we're joined by families, by individuals living with disabilities, their caregivers, and their loved ones. And they're here today to tell their stories about this government's failure to provide care for adults in this province living with intellectual disabilities. Tara Jo Kadlec is here to tell the story of her brother, Corey. Corey passed away just weeks ago. And last year, Corey spent 10 months locked in a dementia ward because of the lack of appropriate care placement in the community. His family says, Mr. Speaker, that he never recovered from this experience. What does the Premier have to say to this family, to Tara Jo, and to her family about why they're failing so badly?
Recognize the Minister of Social Services.
I welcome Tara Jo, and very sorry to hear of the passing of Corey. I know this, I'd heard about this case many months ago, I should say, Mr. Speaker. I know there sometimes is challenges in finding placements for group homes for highly specialized needs on the medical intervention side of things. Mr. Speaker, the health minister and myself have recently met with parents who are interested in having a group home available for those who have those extremely high medical needs that it's probably not the best setting for them in a long-term care home or in a hospital, for example. They might be younger than all the other residents, and it might not be the best spot for them, Mr. Speaker. So the government is actually looking at the possibility of that. There's examples in other provinces that the Ministries of Health and Social Services are also looking at to better meet the needs of clients who don't necessarily shouldn't be in a hospital setting.
Recognize the Leader of the Opposition.
Mr. Speaker, this isn't a one-off failure. This is a system failure. Corey had Down syndrome. He was 41 years old. He loved dinosaurs, Jurassic Park, burgers, and spending time on his dad's farm near Davidson. And he had health needs that weren't being met in the community. Tara Jo fought tooth and nail for Corey to live somewhere where he felt safe. And he finally ended up in the family's care. From there, Tara and the family had to fight every day to get basic help. How is this acceptable in Saskatchewan in 2024?
Recognize the Minister of Social Services.
Mr. Speaker, in terms of group homes, we've been able to increase the budget. There's been a growing need, of course, Mr. Speaker, in our province since we've formed government. The disability program area, for example, has gone up by $248 million. That's a 348% increase, including in this budget. This government has also brought forward individualized funding to fill gaps in programming that the traditional group homes may not fill the needs. So, Mr. Speaker, we're actively looking at ways to support those with the highest complex medical needs in our province, and that work will continue.
Recognize a member from Regina Elphinstone Centre.
Mr. Speaker, Tara Jo and her family did everything that they possibly could to get the support that her brother needed. But the supports available to them just weren't good enough. And Corey suffered needlessly, and Corey's family has suffered needlessly as a result. We're joined today by many fierce advocates who don't want to be here. They wish they didn't have to fight so hard. Brenda and Candace Olson have joined us together with their son and brother Jerome. Jerome lives with cerebral palsy. He's been in and out of homes. His family is tired. Jerome is back living with family because they feel they're out of options within the system. We're also joined by the gardeners who care for Matthew Brandon of the For the Love of Matthew page, who described the lack of support from the ministry in their time with them over the years as, quote, a living nightmare. When will this government invest in sufficient supports for those living with developmental disabilities in Saskatchewan and start to lift these families up?
Recognize the Minister of Social Services.
Thank you very much, Mr. Speaker. In my time as the minister, I've been able to meet with several of these families and work with them. I know the ministry works very hard to find good placements or good situations. Sometimes they may not be ideal based on what is happening throughout the system, Mr. Speaker, but I would note the increases we've been able to make, this government's been able to make in the CLSD area, 348% increase, as well as this budget, Mr. Speaker, 10 new group homes, Mr. Speaker. The member from Westview and Eastview were just recently in Saskatoon with myself to open with Elmwood new facilities. 3 new facilities, 2 new were announced as well, Mr. Speaker. There's certainly more work to do in this, but we're able to do that with a strong growing economy to help find the best placement possible. It may not be perfect at the time, but we'll continue, the ministry will continue to work with families to find an ideal situation going forward.
Recognize a member from Regina Elphinstone Centre.
Mr. Speaker, these are not new issues, and this government is moving at a snail's pace to bridge these gaping chasms. The lack of coordination between health and social services is failing individuals living with developmental disabilities in this province. Most homes have no nursing care at all. The lack of collaboration means an unacceptably low quality of care. The management of health issues often falls to exhausted family members. Individuals like Tracy Belial, who is here today with her son Brandon, who requires a high level of support. He's been on a wait list for a group home for over a decade. Nothing else available. Brandon, who is a social and bright young man, was recently placed in a totally unacceptable situation with 4 nonverbal seniors. Medication errors and a lack of suitable care led Tracy to pull him from that placement on the advice of Brandon's doctor. Does the minister really think that the status quo is good enough?
Recognize the Minister of Social Services.
Speaker, in terms of the group homes, I want to go on record and thank so much the group homes and all the DSWs that work, disability support workers who do great work each and every day and sometimes in very difficult cases. So I certainly appreciate that effort with the dozens of group homes that the ministry has contracts with and good work happens every day, Mr. Speaker. And just again, in this budget, there's been increases to wages, and that's on top of several in the past few years since I've been the minister and previous ministers before that. But also on the operational side, this budget came forward with the operational oversight unit to work with third parties, to work with our CBOs to ensure there's governance structure in place, as well as on the operations side as well to make sure our most vulnerable people in our province are looked after. That's on top of increases, Mr. Speaker. Granted, I know there is more work to do in this area, but I want to continue this work as we go forward.
Recognize a member from Regina Elphinstone Centre.
Mr. Speaker, the minister touts increases. I can't stress enough that this sector is in crisis. The auditor reported on this back in 2021. She identified risks, a lack of oversight, a lack of standards. She made 9 recommendations, and the last that we were updated, none of them were fully implemented. I raised these issues with the former Minister of Social Services going back to 2021, how the lack of training and wages for staff impacts those living with disabilities in these group home settings, and it's only gotten worse since then. A turnover rate of 30% means that individuals will have over 1,000 different people providing intimate and personal care over their lifetime. A revolving door of care is not only undignified, it's dangerous. Will the minister finally listen to these families, take the crisis in the sector seriously, and stop with the lip service and the slogans? Stop talking about making Saskatchewan the best place in Canada to live with disabilities and make it happen. Hear, hear. Hear, hear.
Recognize the Minister of Social Services.
As I mentioned before, Mr. Speaker, I have met with many of these families that the member has brought forward. We thank them for being here to, again, tell their story. I think that's important to keep that on the attention of myself and the government. But I think this government has acted. Is there certainly more to do? I've talked about the increase on the wages side, but also on the capital side, the operational side for our valued CBO partners. And again, I want to thank each and every one of those. And the member's right. Some of the DSWs, the disability support workers, are they almost become family to many of the people that they do look after, and we thank them for their work each and every day for doing that. And so, again, we partner with third parties to deliver good service. Nearly $500 million in wages just this year to the CBO sector, 3% lift. So. There's certainly more to do. I acknowledge that, Mr. Speaker. I think this government has been committed, and it's shown that through the last several budgets.
Recognize a member from Regina Elphinstone Centre.
The 3% lift that may not even make it to those frontline workers. Thank them in action, not words. Mr. Speaker, then there are the families that can't get access to institutionalized care or a group home who are left to go it alone. Families like Kathy Chartiers, whose daughter Rebecca has low-functioning autism and the mental capacity of a 5-year-old. She requires one-on-one 24/7 care, but Kathy doesn't receive close to that. She gets 30 hours per week and has to fill in the gaps at great personal and financial cost. She doesn't get the support she needs from this ministry through self-directed funding to provide a safe situation for her daughter. She's told that a group home waitlist is long. She and her husband are growing older. They worry about what will happen to Rebecca when they're not around anymore. When will the minister put in place the supports that families like Kathy and Rebecca need and deserve? Finally, will the minister set up follow-up meetings with the families that have attended here today so that their stories can fuel true action? Hear, hear.
Recognize the Minister of Social Services.
Well, again, I would submit to the member there has been significant investments in this area, 348% increase in the years since this government has had the honour to serve in this great province, Mr. Speaker. So there is self-directed funding that is new to this government. CLSD, the folks in that part of the ministry do great work, and it's sometimes challenging work, and there is always work to do. And again, I met with the Push families, as was mentioned by the member opposite, to try and find a way to fill some of the gaps that are out there. The self-directed funding is part of that. The increased funding to group homes is part of that as well. On the wage side, on the operational side, the operational oversight unit is a very important part of those commitments. But, Mr. Speaker, there's more to do, and particularly those who have very high medical needs, and we want to find the right setting for them.
Recognize member from Regina Elphinstone Centre.
Mr. Speaker, on the record, I'll ask for a commitment from the minister to meet with each of these families in follow-up meetings so that their stories can fuel change. Hear, hear.
Recognize the Minister of Social Services.
Again, Mr. Speaker, met with several of these families and would be honoured to do so once again at their convenience.
Recognize the member from Saskatoon Fairview.
Mr. Speaker, this government is failing to deliver in social services, and they're failing to deliver when it comes to health care. We hear story after story from nurses and healthcare workers about the challenges facing our hospitals. $139 million spent on contract nursing by December, fire code violations and stop-the-line procedures in emergency rooms. Healthcare workers have the answers, but this tired and out-of-touch government isn't listening. It's Nursing Week, and the minister has the opportunity to do the right thing. Will he finally say yes to a nursing task force?
Hear, hear.
Recognize the Minister of Health.
Thank you, Mr. Speaker. And as part of Nursing Week, National Nursing Week, and including here in Saskatchewan, we're very grateful and want to extend our appreciation and gratitude to all the nurses of all designations, 19,000 nurses across this province, Mr. Speaker, and a growing number of nurses here in Saskatchewan serving the people right across our great province. So, Mr. Speaker, we are committed to creating more opportunities for nurses here in Saskatchewan. It's why we have been meeting with them regularly, meeting with frontline healthcare providers, meeting with the unions, Mr. Speaker, working to establish more training seats, for example, Mr. Speaker, to create more training opportunities here in Saskatchewan so that we can train more of those very valuable nurses of all designations, and then in addition to that, get them hired into our facilities right across this province, Mr. Speaker. That's the level of commitment that we have shown in the past, Mr. Speaker. We'll continue to collaborate very closely with nurses and continue to do this in the future, Mr. Speaker.
Hear, hear.
Recognize the member from Saskatoon Fairview.
Mr. Speaker, listening to local voices is what's needed to fix the problems in healthcare. But this tired and out-of-touch government doesn't listen. That's why emergency room nurses have to send open letters to the minister's office, and it's why nurses have been asking for a nursing task force for over a year. Saskatchewan people deserve a government that listens to frontline workers, not lobbyists and consultants. Why won't the minister call for a nursing task force? How will he get to the root of the retention issues in healthcare?
Hear, hear. Recognize the Minister of Health.
Thank you, Mr. Speaker. And we have been working to listen to nurses, to hear from them, to meet with them whenever possible, Mr. Speaker, to not only hear from them directly some of the challenges that are out there in our healthcare system, but also the solutions, Mr. Speaker, to those challenges. For example, as we've talked about for some time now around challenges at St. Paul's Hospital in Saskatoon, we've been working very closely. I have met personally with nurses there. I've been to St. Paul's, Mr. Speaker. We've asked Mr. Speaker, that SHA senior leadership be engaged with them. And as a result of that, Mr. Speaker, some of those ideas have been brought forward as part of the Saskatoon Capacity Pressure Action Plan, and ideas that have been coming directly from frontline healthcare providers, including nurses, including doctors, including others in leadership positions there, Mr. Speaker. We're going to continue that engagement and make sure that we are listening to frontline healthcare providers, hearing from them the challenges, but also the solution, and working closely with them to implement those solutions, Mr. Speaker.
Recognize a member from Regina University.
Thank you very much, Mr. Speaker. This tired and out-of-touch government is failing to deliver basic healthcare services to people in this province, and they're failing to deliver support for vulnerable people as well. They're also failing to create good jobs and to grow this economy. Let's just look at the value of merchandise exports. For 11 consecutive months, the value of merchandise exports in Saskatchewan has fallen year over year. Job growth is anemic, corporate profits are falling, and shortly government tax revenues will be falling too. Now, Mr. Speaker, the Premier and his ministers spend thousands of dollars flying around the world, but they're delivering less this year than they were last year, and those are the facts. So, Mr. Speaker, my question to the minister, why didn't he bring up that fact this morning in his fireside chat with the Premier and former Prime Minister Harper?
Recognize Minister of Trade and Export Development.
Well, I can't tell you how happy I am to talk about the economy here in Saskatchewan, Mr. Speaker. $78 billion of GDP. Those numbers just came out, I believe, last week. Second in the entire country in growth. Year before, over a 6% growth rate in our GDP, Mr. Speaker, leading the Canada. Our exports are up nearly $50 billion this year, and I can tell you a big part of the discussion today at the Food, Fuel and Fertilizer Summit put on by the Sask Chamber of Commerce was about how we keep that momentum going, how we continue to grow our exports, $50 billion this year. And keep in mind, in the final year of the NDP government, which was probably their best year, exports were $16 billion, Mr. Speaker. $50 billion of exports on $78 billion of GDP is how this government is able to pay for all of the services that are provided. It's how the budget has gone from $7 billion a year when we formed government to nearly $20 billion a year this year, Mr. Speaker. Growth is what pays for all of the services that we so value in this province, and that's what we're committed to.
Recognize a member from Regina University.
Well, thank you very much, Mr. Speaker. Let's talk about those StatsCan numbers, because you know what they show? Ag, down. Forestry, down. Mining, down. Oil and gas, down. Construction, down. Transportation, down. Let's talk about that, Mr. Speaker. And let's also talk about this government's contract with Stephen Harper. Every year, we pay Calgary-based Harper & Associates $250,000 every year to help this struggling government. Almost $1 million since this Premier came to office. And when we FOI'd the contract with Harper & Associates, Mr. Speaker, can you guess what happened? It came back redacted. Almost every detail withheld for the actual description of work that the taxpayers of Saskatchewan are paying Harper & Associates to do. How does the minister justify this total lack of transparency?
Hear, hear. Recognize the Minister of Trade and Export Development.
Well, Mr. Speaker, I wish that member had listened to the discussion today that occurred at the Food, Fuel and Fertilizer Summit put on by the Sask Chamber of Commerce, because what she would have heard from business leaders, from partners, from stakeholders, including chambers of commerce across the province, are the vital importance, Mr. Speaker, of international engagement, about why our direct engagement with leaders around the world has resulted in literally hundreds of millions of dollars of opportunities for our companies to do business, which results in tens of thousands of jobs here, Mr. Speaker. The fact that their export numbers were only $16 billion in their best year, Mr. Speaker, speaks to the fact that this doesn't just happen. And we know it doesn't just happen because it never happened when they were government. We need to engage. We need to support Saskatchewan. We need to work with our companies. We need to sell the province. That's what we're committed to doing, and it's showing real results.
Recognize a member from Saskatoon-Meewasin.
Thank you very much, Mr. Speaker. The addictions crisis in our province continues to take lives. Later this week, the coroner will release new overdose numbers that will show what we already know. This is a crisis out of control. Last year, we set a record for overdose deaths, Mr. Speaker. We're on track to set another record this year. This government touts its treatment-oriented model of care, but you can't check into treatment if you've died of an overdose. How many more months of record deaths will it take before the Sask Party changes course and provides the evidence-based supports people need to stop the harm?
Hear, hear.
Recognize Minister of Mental Health and Addictions.
Thank you very much, Mr. Speaker. As I've said before, and I will say again, every loss of life due to an overdose is a tragedy, and our condolences are extended to every family that's impacted, because we know that addiction reaches beyond just the individual, Mr. Speaker, and it impacts families and communities as well. We also know, Mr. Speaker, that the best way to prevent overdoses is to help individuals overcome those addictions. And we are doing just that with our action plan on mental health and addictions, Mr. Speaker. We are adding 500 addictions treatment spaces. We are making it easier for people to access those spaces, and we are giving people the services and supports that they need through recovery-oriented systems of care to ensure that they can live healthy, safe lives in recovery. Thank you, Mr. Speaker.